Speaking of misinformation and the announcement from yesterday, for how long has the administration been spying on people's Facebook profiles looking for vaccine misinformation?
Well, that was quite a loaded and inaccurate question, which I would
Inaccurate
refute.
how?
Well, Peter, first of all, as you know, we're in a regular touch with a range of media outlets.
And we expect that the White House is watching
Let me
Fox,
finish.
but
As
you
we
can post
are
on Facebook.
as we are in
Expect-
regular touch with social media platforms. This is publicly open information. People sharing information online, just as you are all reporting information on your news stations.
But, okay, so these 12 people who you have on a list, 12 individuals, do they know that somebody at the Surgeon General's office is going through their profile?
I'm happy to get you the citation of where that comes from. There's no secret list. I will tell you that these are people who are sharing information on public platforms on Facebook, information that is traveling, is inaccurate. Our biggest concern here, and I frankly think it should be your biggest concern, is the number of people who are dying around the country because they're getting misinformation that is leading them to not take a vaccine.
But-
Young people, old people, kids, children, this is all a lot of them are being impacted by
The
misinformation.
big concern, though, I think, for a lot of people on Facebook is that now this is Big Brother watching you.
They're more concerned about that than people dying across the country because of a pandemic where misinformation is traveling on social media platforms. That feels unlikely to me. If you have the data to back that up, I'm happy to
Okay,
discuss
and
it.
just about things that are on Facebook, I looked this morning. There are videos of Dr. Fauci from 2020 before anybody had a vaccine, and he is out there saying there's no reason to be walking around with a mask. So is the administration going to contact Facebook and ask them to take that down?
Well, first, I think what Dr. Fauci has said himself, who's been quite public out there, is that science evolves, information evolves, and we make that available in a public way to the American people.
Exactly.
I have never seen any data to suggest that that the vaccines cause infertility. That is information that is irresponsibly traveling. Okay,
Just
I
one
think.
more. Just one more. Sorry, excuse me. Just one more. Okay, about the science, about the science evolving. Facebook used to block people from posting that COVID may have originated for a lab. That is something this president now admits is a possibility. So, is there any concern that things you're trying to block or have taken down might someday turn out to be?
We don't take anything down. We don't block anything. Facebook and any private sector company makes decisions about what information should be on their platform. Our point is that there is information that is leading to people not taking the vaccine and people are dying as a result. And we have a responsibility as a public health matter to raise that issue. And the responsibility we all have, the government, media, platforms, public messengers, to give accurate information. Go ahead.
Quickly about the 12 individuals that are on that separate site. It's not from the White House. I don't have the source in front of me, but we've read it as well. Can you give us a sense of who those individuals are, as was asked before, and what specifically you've given a tough message to the social platforms that they should do more, the social media platforms. What from this podium is the message to those individuals, the 12 of them, who are responsible for 65% of the misinformation that's out there?
The message is the same message as it is to every person out there who has a platform, whether that is an elected official or that is a person who is a civic leader. The vaccines are safe, they are effective. If people take them, they will save their life in many cases. And so our message to everyone who's sharing misinformation is that the steps you're taking are irresponsible. They could lead to people getting very sick and people ultimately losing their lives. Why don't we all participate in a process that will help provide accurate information out there?
Has the White House participated in any direct contact with these individuals, given the impact they're having through any avenue to try to say, knock it off?
No, and I'm happy to get you guys the data on where we got that information, where the public, it's a publicly available data. We'll get you the citation is what I mean.
Let me ask you if I can then about some of the other numbers as they relate to COVID right now. Obviously, due to the Delta variant, COVID cases are up sharply right now. Testing is down right now. How concerned is the White House that this variant, COVID in general, is much more widespread than we're aware of publicly at this time?
You know, it's a great question. I don't want to speak out of turn here because it's really a question for the health and medical experts on how they're tracking it and how concerned they are. We certainly know on transmissibility and based on the CDC data that the Delta variant is impacting the majority of people who are getting sick with COVID now. We also know that 99.5% of people who are in the hospital are people who are unvaccinated, and people who are dying of COVID unvaccinated. The data is very clear. As Dr. Walensky said on an earlier briefing today, this is really becoming a pandemic of the unvaccinated, and that means getting vaccinated, you can save yourself.
Is there anything that the White House is doing differently? We saw the president proudly in Philadelphia shaking hands with a lot of folks when he was there for his voting rights speech earlier this week. We saw something similar last week when he was in Illinois. Given the reporting about some breakthrough cases right now, are there any things that the White House is doing differently as it relates to your own staffing or the president's handling of his sort of activities due to those new numbers?
No, we are vaccinated. The president's vaccinated. We are all vaccinated.
So breakthrough cases are not something that you or
We
Americans should worry about.
we still have a testing protocol and process in place for White House staff, so that has continued.
And for those individuals that he would be shaking hands with, there's not any. Basically, shaking hands is good if you're vaccinated.
We abide by public health guidelines as it relates to the president's engagements, and if public health guidelines changed, which I'm not predicting, we would continue to abide by them. Go ahead.